Hello and happy holiday to everyone. It's a Tuesday afternoon po and we are happy to join us. Sorry po, yesterday was supposed to be the talk on the emergency room but nawalan po kami ng kuryente dito po sa San Luis. But we are now back on track. So ako po, I'm Dr. Ana York Bondoc. I am an internal medicine and pulmonary specialist. I'm a former congresswoman po and a mom. So tayo po ay naghahandog ng libreng konsulta sa araw-araw po na aming makakayanan. So ang pag-uusapan po natin ngayon, very interesting. It's ano ho ba talaga ang nangyayari sa emergency room and kailan po dapat pumunta. Okay? So please put your messages below po tungkol sa emergency room kung meron po kayong tanong. If you have a personal story kung kailan po kayo na emergency room, put it down po. We'll read it po and we will also comment. Ako po, I'll also share personal stories about how ako po and my family were able to be helped by the emergency room. So, wag po kayong matakot sa ER and I will walk you through the process kung ano po ang nangyayari dito sa tinatawag po nating emergency room or ER. So, please follow us, like and subscribe po, YouTube and Facebook. So, let's start. Okay. So, siguro our topic today, let's start. Ano nga ba ang emergency room? Ano? What's the emergency room? So, sige, I think I have a few guide questions for us to be able to move the topic forward. So, guide question, ano ba ER? Okay. Would you mind to project the question, guys? Okay lang. Minsan mabagal po yung internet namin. Ayan. The question po is, ano po ang ER? It is written po in the caption. Okay, so let's change our caption, sorry. Okay, so ano po ang ER? Ano po ang ER? Ang emergency room. What is, later po yon yung project po nila, no? Pasyensya na po. So ano po ang ER? What is the emergency room? Ang ER po, it's not the TV series, okay? The emergency room po, yun po yung isang section ng ospital. It is usually a very important section of the hospital. And dito po tinatakbo or dinadala or pumupunta ang mga tao pong may problema pong acute. What is the meaning of acute? Yung biglaan po, something that happened with very quickly that necessitates po na pumunta po sila sa ER. Okay, this is different po from chronic. Okay, what is the meaning of chronic? Yung chronic naman po, matagalang sakit. Like for example, diabetes. Pero let's say po, nabundol ang isang taong may diabetes, then the acute problem, nabundol. The chronic problem, diabetes. So pupunta po sila sa ER. So the people who go to the ER, as I mentioned, sometimes dinadala po ng ambulance. Often, usually abroad, tumatawag po sila ng 911 and the ambulance will bring them to the emergency room. Okay? And then, sometimes naman po, wait lang po, let's ask them to. Sometimes naman po, like here in the Philippines, mabagal po yung ambulansya. Sometimes we don't have that many ambulances. We do not have an organized 911 system. So often people bring ambulance po, no? Number 1 yan, nakikita natin sa abroad. Hello, 911, punta tayong ER. Sa Philippines po, we don't have unorganized majority, no? Sometimes there may be, but marami po talagang kulang sa 911 system natin. We often bring people to the emergency room via car. Okay? Yung iba po, dinadala po sa sasakyan. Okay? Yung iba po, pag talagang wala po silang sasakyan, they would hire a jeep. Once I was in the ER po, in the emergency room po ng PGH, pag dinala po ng jeep, that usually means that it's really a very serious problem kasi usually people don't have much money, umarkila pa po sila ng jeep. And of course, there's always the walk-in. Pwede naman hong dumating po doon, ano? So that's it. The emergency room is usually a place that accepts people po na usually walang appointment, unlike clinic, sumusugod na lang po sila doon. As you can see, sometimes sa TV, tinatawag po ng 911 operator or ng paramedic coming po 59-year-old male, gunshot wound, BP, ganun po. So sometimes, tinatawag po in advance. Sometimes, your attending doctor will call the ER to expect their patient, but most of the time talaga, biglaan lang po talaga ang pagdating natin sa isang emergency room. Okay? Next question. Kailan tayo dapat pumunta sa, there are different kinds of ER nga naman. But let's go with, kailan po tayo dapat pumunta sa ER? Okay? When do we go to the ER? Okay? We go to the ER when it's an emergency. So ano bang meaning ng emergency? I always tell people, if you need to go, then you need to go. People ask me, how do I know that I need to go to the emergency room? May ka ba talaga? May ka ba talaga? Pag feeling mo talaga na hindi mo na po nakayanan sa bahay, people nagpapadala na po sa ER. Usually, people don't like to go to the ER, and I personally don't like to go to the ER. But there are times po na talagang we need to go to the ER when it is an emergency. Okay? When is it an emergency? It's really hard to say, and it depends po with every doctor and with every patient. Normally, there are cardinal signs po of, for example po, trauma ER, surgical ER, nasagasaan, sinaksak, binaril, nahulog, nagbigti, nabalian. Those are surgical emergencies or trauma emergencies. And immediately, wala na hong tanungan, dinadala po yan sa ER. Sa medicine po, the situation is a little more difficult, okay? Usually, people tend to go to the ER kung talagang sobra po ang mataas ang lagnat, nahirapan na po talagang huminga sa bahay, and what we call chest pain po or possible, napakasakit po ng kanilang dibdib, possible heart attack. Okay, so those usually are the three. And then, loss of consciousness, nahihimatay, nawala ng malay, tinatakbo rin po yan sa ER. And then, poisonings, yes, they go to the ER. So, usually, ganun po. Something that's just terrible. Kung minsan po, it's hard to judge, it's hard to force people when to go to the ER. Pero sometimes, what I always tell people is, kung talagang feeling yung kailangan yung pumunta, well then, kailangan yung pumunta. Okay? Question number 3 po sa atin pong captions. I will read it para mag-guide po yung mga nagpa-flash. Ayan. Letter C po, kailan hindi dapat pumunta? Okay, kailan po dapat pumunta sa ER? Pag emergency, okay? How is it an emergency? Number 1, call your doctor. Number 2, pag talagang hindi nyo na kaya. And number 3 po, when you just really feel like you need to go. When not to go to the ER? When it's not an emergency, okay? Ano ho ba ang hindi emergency? Okay. Ang hirap pong sabihin yan eh. But kung matagal na po yung problema and you just cannot call up your doctor, that is usually not the best time to go. This is very common po. Not so common sa Pilipinas yung maling punta sa ER. Kasi po sa Pilipinas, you have to pay. So kung minsan, yung mga tao po, talagang pinipilit nila hanggat sa kahuli-hulihan before they go to the ER. Mali rin po yon. However, in the US po, usually it's the insurance or the government who pays. And kung minsan po, nagkakaroon talaga ng mga people who just go to the ER for minor issues. Okay? I would suggest po, kung talagang sa tingin nyo, kaya naman po sa clinic, or it's not really that important, you just wait the next day for the clinic. Kasi po, an ER is normally crowded, maghihintay po kayo na matagal, at hindi po pa po kayo maaasikaso ng kilala nyo pong doktor. So when not to go to the ER, when it's minor. Number 2, when it can wait for the next day. And number 3, kung ayaw nyo po talagang ma-charge or makipagsiksikan. Kailan po dapat pumunta sa ER? I always like to say this. Go to the ER in the morning hanggang hapon. Kasi po, pag pinilit nyo po na abutin po kayo ng gabi, ang hirap-hirap po talagang tumawag ng doktor, gumawa po ng mga procedures at kung ano-ano pa. So, kailan hindi dapat po pumunta sa ER? Pag gabi na. So, if you feel like you're going to the ER po, or may nangyayari na po, try to call your doctor in the morning. Huwag pong tiisin hanggang umabot na po ng alas 8, alas 10, until alauna po ng umaga. So, try to go early if you're going to go. Okay? Next question po.
Okay, next question,
What
Miss
to expect?
to
What to
expect.
expect po, no? What to expect when you get to the ER? First of all, the ER is a busy place. Okay? 99% of the time, the ER is a busy place. Okay? Least busy time in the ER, umaga hanggang around 2 to 3 o'clock. Pagdating po na alas 4, ratsada na po yan hanggang mga alas 2 ng umaga. That is always po what happens. Kasi why is the morning the less, ano po, because most of the people can contact po their doctor in the morning. Okay? Most of the people can contact their doctor in the morning. And then later on, pagdating po ng mga 6 o'clock, wala na po yung mga doktor sa mga clinic. So people tend to go to the ER and it really gets very busy at night. Okay? Number 2, because the ER is a busy place, sinabi ko nga po talaga, try to go lang ho talaga when it is an emergency. So the best thing, if you can call your doctor and consult, if you can go to the doctor and consult, call up your doctor first, and mag-usap po muna kayo and then proceed to the ER. Wala naman pong problema. Okay? But again, if you cannot contact your doctor and nininervous na po talaga kayo and you do feel that you need to go, then you need to go. Kahit po gabi. So, what to expect? Busy. Number 2, maraming tao talaga. Unless your condition po is life-threatening, most likely talagang eto po talaga ang number 1 complaint ng mga tao. Tagal ng hintayan. Matagal na po akong doktor, number 1 complaint, matagal po ang hintayan. That is true. Why? Okay. When you go to the ER po, no, unless kayo ho yung sinaksak, nabundolo na atake, uunahin ho talaga nila yung mga taong life-threatening. And thank the Lord po na hindi po kayong inuuna. So, unfortunately, sa dami po talaga ng mga taong naghihintay, you will wait. Okay? And kaya nga sinasabi ko, kung minor lang po, umuwi na kayo or go the next day to the clinic. Kasi po, yung waiting po talaga, dyan ho talaga 99% of the away happens while waiting. Talagang kasi ang dami nagtatanong, ba't ang bagal-bagal? Ang dami po talaga kasing mga nauuna. And sa ER, it is not first come, first serve, okay? It is most important first. Or yung possibility pong may namatay. This concept is called the triage, Triage. And thank the Lord na lang po na pwede kayong maghintay. Kasi kung nauna po kayo, well, then that's really not a good thing. Okay? What to expect din po, they will, if your condition is serious, you can expect the ER to do tests. Testing po talaga, you can also expect. You'll most likely po need x-rays, blood tests, EKGs, possibly echoes. So testing po talaga is what to expect. And then number 4, you can expect po na iba't iba pong doktor ang titingin po sa inyo. Because likely po, your doctor is in the clinic, maybe your doctor is at home, maybe your doctor is not on call. So you'd have to paulit-ulit na lang pong inuulit yung kwento nyo and nakakarindi rin po yan. Kung number 1 issue is waiting, number 2 issue is ba't ang daming tanong. Unfortunately, in the US po kasi, they can get your medical record. In the Philippines po, they just have to keep asking you the same questions. So, the best thing to do, know your medical history at dalhin nyo po lahat ng gamot nyo nakabag at ibagsak nyo po doon pagdating nyo po sa ER. Another thing is keep in touch with your doctor when you're in the ER kasi talagang ang hirap-hirap po to meet a lot of new people, to keep repeating the same questions. And it can be very comforting po to have your doctor on the phone with you who is hopefully in that hospital at para po kayo pwedeng mag-usap bilang doktor. Okay? So, next guide po question that we could decide. Ano po ang mangyayari? Okay, once you go to the ER po, let's say na-assess na po nila yung problema nyo, no? You were triaged, you were assessed, kinausap po kayo ng doktor, na-check up, and then they did a bunch of testing po sa inyo. Usually, what will happen, no? Sometimes, in the beginning, kung talagang minor lang ho, like, for example, small wounds, things that can be taken care of, nahahati po kuminsan yung emergency room into medical or acute at saka ambulatory or major and minor. So people sometimes, dito po sa PGH, we did this more than 20 years ago. If you can still walk, you go to the major ER. If you can no longer walk, if you can no longer walk, you go to the major ER. If you are still walking, you go to the minor ER. Yun po yung ambulatory. Para po, yung mga namamatay will be separated from hindi namamatay. Okay? So, yun po yun. What if you are, however, deemed na medyo nahirapan na po and major, so they will assess, tests, x-ray, blood test, lahat po, no? And then they will come to the conclusion. There will be there will be three outcomes sa inyong ER. Number one, ma-admit po kayo. Okay? Lalo na po, if you are in emergency, at trauma case, kailangan po kayo operahan, you will be admitted. Okay, number two, kung hindi naman po ganun ka-serious, some people stay overnight in the ER for observation. And the next morning, titingnan po nila kung grumabe to be admitted, kung hindi naman po pwedeng umuwi. And number three po, you may be discharged. For example, dog bite, okay? Nabakunahan ng rabies, you may be discharged to go home. So yun po yung tatlong outcomes, ano? Being admitted, being observed for a short period of time, and number three, being sent to home po with the proper testing. And ang importante po, pag kayo po ay napauwi, that there must be a follow-up po sa outpatient clinic o sa inyong doktor. So yun po yun. That's the sequence of the ER. You're brought to the ER in an emergency or acute situation. Inaalagaan po kayo, ina-assess kung ano po yung problema, kung serious o hindi serious. If the problem requires test, blood test, further referrals po sa doctor, yun po yung ginagawa. And once we figure out the problem po, you are either admitted, observed, and sent home. So yun lang po. Yan po ang nangyayari sa emergency room. It is a scary place, but again, it is a place po that could save your life. So my tips, kung kailangan nyo talagang pumunta, please go. Try to keep in touch with your doctor din po. Do not use the ER po sa clinic. Kung pwede naman sa clinic, then go there. Try to go there po habang may araw. And number 5, nako talagang habaan po ang pasyensya dahil maraming tao. And number 6, I hate to say this, panahon po ng COVID ngayon, most likely po, and this is very sad, marami po talagang swab test na gagawin doon. Especially if you are with a fever, with a cough, or nahihirapan huminga, expect to have a swab test. And number 7, unlike sa US po, na marami pong covered sa ER talaga, magastos. So yun lang po. I've worked in the ERs, I've manned ERs, I've been an ER patient. My mom, my son, hindi pa ho my husband, but in the ER na po lahat yan. I am grateful to the emergency room for taking care of my patients and then taking care of my family. So wag po kayo matakot sa ER. With proper use, you can emerge po with the proper diagnosis and magiging mas mabilis po ang inyong paggagaling sa inyong hospitalization. So thank you so much and let's go through the questions.
Doktora, mga nabalian sa ER din ba?
Yes, that's actually a good question. Fracture, ano po? Open fractures, yung dumaan po sa buto, sa laman. Serious fractures like big accidents po, car, motorcycle, even falls, yes, they should go to the emergency room po. Fractures, nabali, displaced shoulders, ganun po, ER talaga yan. And an orthopedic surgeon will look for you. An orthopedic surgeon will look after you.
For question from Ms. Serena Galoy. Good afternoon, Doktora. Naitakbo ako sa ER nang nag-vomit ako na walang stop kasabay na LBM for 30 minutes kasi bigla ako nawalan ng malay. Nang nagkamalay ako, nasa ospital na ako sa ER at nag-chilled ako, nahirapan nurses, nalagyan ako ng dextrose. Thanks God, naitakbo ako agad kasi bumaba na pala potassium level ko.
Yes, Ma'am Serena, I'm glad that you went to the ER. That is true. Yung yung talagang grabing-grabe na that's actually called food poisoning eh. Dumi ng dumi, suka ng suka, if it's coming out of two openings, ano yung dumi dun ng dumi, pwede pa ho yun habulin ng Gatorade or Orisol. Pero pag suka ka na ng suka, plus dumi ng dumi, then di mo na kaya, you need to be admitted. Some people are admitted from the clinic. Ako po, I was admitted sa Cardinal from food poisoning due to oysters. Yes, ERable po yan. I'm glad that you got better. And tama po si ma'am because once you keep throwing up and you really cannot keep anything down, talaga pong we have to replace potassium and other electrolytes. Excuse me po.
Doktora, what is a triage? Bakit sa labas ng ER ang mga nurse naka-tent?
Ayan, ang ganda niyan. Okay, there are actually two issues brought up here, ano? One is the word triage, okay? And then the one is na bakit ngayon nasa labas na yung mga tao sa ER, okay? So, triage is spelled Triage. What is the concept of triage? Reina, did you know that the word triage came out of a battlefield situation, okay? Nung unang panahon, people were triaged according to the number of injuries that they sustained in a war. Tapos, depende kung sino talaga yung mamamatay at hindi mamamatay. And would you believe, Reyna, dati, and guys, yung inuuna po nila, yung hindi mamamatay, lalo na sa battlefield. Kasi yung mamamatay na lang. Because we are in a battlefield situation. Pero ngayon po, mas modern na po ang medicine. I'm happy to report, okay? So the concept of triage is to gauge each person according to the seriousness po yun ng kanilang sakit or sitwasyon at kung sino po ang dapat unahin. Okay? In the modern triage, it is good to be the last kasi that means pinaka-minor ka. Okay? Ikaw, Reina, have you ever worked in an ER?
Yeah, yes, Doktora, ER nurse po ako before. Kasi inikutan yan, hindi po kami pwedeng graduate nang wala kaming rounds to all of the departments sa isang hospital.
Yes, tama yan. So, where is the triage? The triage is the person who will interview you. Tatanungin po nila, ba't po kayo pumunta sa emergency room? And then, depende po sa inyong history, sa inyo pong vital signs, at sa klase po ng problema, they will decide whether you should be the first or you should be the last. And thank God if they decide that you should be the last. Kasi for example, eto lang Reina, for example, may pumupunta doon crushing chest pain. So, heart attack yun eh. So, that person requires immediate action para buksan yung puso niya. He will be the first. Ngayon, ikaw, for example, nahirapan kang huminga, you're asthmatic, kung mild lang naman at mukhang okay pa, then they'll nebulize you muna with Ventolin at mauna muna si heart attack. Okay, so basically, ganun po talaga. That is the concept of triage. How do they triage people? Number one, based on the most common complaint. Ano ba yung reklamo mo? Okay? Kasi left-sided chest pain trumps all kasi cardiac yon. Okay? Also, a stroke is very important. That has to be triaged first. Okay? Another thing po, aside from the chief complaint, the history. Is it the first time that you went to the ER? How long has this been happening na po, no? So, important po si history. And number 3, your vital signs. Kung may blood pressure ka pa, malaking bagay yon. Kung 40 na lang po yung blood pressure nyo, ikaw na po yung una. And again, of course, trauma is another issue. So, trauma, i-triage din po nila who goes to the ER, lalo na kung marami, for example, multiple car accident, sino po yung yung iba ho, hindi na ho dinadala sa sa OR. They are coded. What is the meaning of coded? Sini-CPR na po in the ER kasi, for example, they lost their blood pressure po or talagang grabe po yung nangyari sa kanila, they are resuscitated na po in the emergency room. So I'm talking about medical po muna, surgical. So surgical po, usually diretso sa OR Or kung talagang grabe po yung nangyayari, they are resuscitated in the emergency room. I forgot to say this eh. There is an area po sa emergency room for CPR, and this is for the people po talagang mababa po yung blood pressure. They might code. Ano yung code? Baka tumigil po yung puso. Or talaga pong tumigil po yung puso sa sasakyan in the ER, in the ambulance, and baka may chance pa po. Okay? So that is the concept of triage. The concept of triage is to decide who should be first and who should be last. And it is by seriousness of the illness. So the next question is, ba't nakatent yung mga tao sa labas ng ER? Okay, panahon po ng COVID ngayon. Okay? So what is the concept there? Why are people intense? Kasi they would like to assess po kung may possible COVID kayo. Kung may possible COVID po kayo, hindi na ho kayo papasok sa loob ng main ER kasi that means lahat po doon posibleng ma-expose sa inyo. So if you are complaining of COVID symptoms right now, there is a triage outside po ng building para po mapupunta po kayo doon sa talagang highly probable COVID patients. So that is the reason why they are now intense. Not because wala na pong space sa loob, but ayaw na po nilang pumasok yung mga possible na positive po sa loob.
Doktora, puro COVID ba ngayon sa ER?
Nako, Rina, number one, misconception po talaga yan. I would like, but I'm glad that this question came after the 10th. Okay, guys? So, kung kayo po, for example, you feel like you're having a stroke or you're having a heart attack, you need to go to the ER po, COVID or no COVID, okay? So, rest assured, lahat po ng tao pupunta sa ER. Kung talagang kailangan, pumunta po kayo. Kaya panahon ng COVID o hindi. And maganda kong yung mga triage ng COVID nasa labas. So, if someone has an ubo, nawalan po ng panlasa o they cannot smell properly, they have a high fever, they are placed in a special area. So, kung hindi naman ho yun ang reklamo nyo, and your reklamo po is heart attack, nabalian, and other things not related to COVID, kasi matagal na ho talagang pupunta sa ER ang mga tao kahit nung walang COVID, I promise you po, hinihiwalay pong mabuti yung mga may COVID symptoms at wala. Okay? So that's a very good question. So rest assured, if you need to go po, kahit na may COVID. Okay? Kasi baka may mangyari po sa inyong bahay. And that is not good. So parang marami ati tayong bati, nakikiusap ata si Ma'am Kat that we greet people first. Siguro we can take a question. Ayan, bati na raw.
Mr. Eddie Ogana, magandang hapon po, Doktora.
Sir Eddie, how are you? To everyone, please share your story sa ER. I'm going to ask you also, Reina and Kat, if you've ever been to the ER and you can make kwento to me. Okay?
From Mr. Ross Ramos, watching po, Doktora, magandang hapon po.
Hi, Ross.
From Ms. Mia Natencio, good evening po, former Congresswoman or Doktora, Dr. Ana York Bondoc.
Hi, Mayan.
From Ms. Teresa M. Tungol, hello Doc, good afternoon po.
Ma'am Teresa, how are you? Magandang hapon po.
From Ms. Mia Natencio, kaboses niyo po si Alice Dixon.
Oh, hanggang boses lang ako. But that's good.
From Ms. Loida Leanticho Diaz, watching from Arayat. Hi, Doktora.
Wow. Hi, Ma'am Loida. Did you know that my dad went to the Arayat Institute? And that his family is actually from Arayat?
From Mrs. Heriales, thank you po, Doktora, sa pag-share ng info.
Thanks, Seth.
From another viewer, Doktora, Diyos ko, ang nagmamahal ang mga ER visit ng sobra.
This is sad, but this is true. I'm really sad to tell you that it is true. All private hospitals po ay nagtaas po ng presyo ngayong pandemic. I don't know why. Sana naman ho, it was to pay for the PPE because I was charged for a PPE. But they were not wearing PPE. Ayoko na lang kung mang-away ng tao. But yes,
Doc,
I am sorry
yes.
to tell you this. I am really sorry. And I hope that the government can work with the private hospitals on this issue. Sinabi po sa akin ng isang ano po, nasa loob po ng ospital, Doc, kasi bumabaho yung census namin, kaya kailangan namin bumawi sa charging. Huwag naman ganon, mga ospital. I understand it's a business, but let's have compassion naman po sa mga tao. Ayoko na lang, okay? My sister-in-law was charged 35,000 for a chest x-ray and a blood test, okay? So, meron pong maling nangyayari and I would like to appeal to the DOH and to the government to work hand in hand po with the private hospitals on this issue. Hindi maganda po ito. Ay, ikaw, Rins, parang nag-react ka dyan.
Ay nako, very, natatawa na lang ako, Doc. Pwede bang tumawa na lang?
Hindi
Ridiculous
ako natatawa, Rins. Ako naiiyak. Ikaw siguro
ridiculous.
nagagalit, so natatawa ka na lang.
Nawala na yung galit ko, Doc. Pero during that time, would you imagine, we're paying per day around 5,000 just for the PPE on a private hospital. You know that.
Which no one is wearing.
No one is wearing. I told you about that story, di ba?
Ako, nangyari sa akin.
So, tsaka mahal po at magastos po at mahirap pong ma-hospital at ma-ER ngayon.
True. Pero yun nga lang, ako, I'm sensitive to gastos. I live and realize po, kasi tumutulong din po kami as part of the job. Pero kung hindi po kayo pupunta, if you really feel like it's an emergency, you need to go po talaga, you need to go. Siguro sa government na lang po, mahirap. I cannot pretend to you na pareho lang ho yung situation eh. It's better to be honest, nang mahal ho talaga ngayon. And I'm hoping that the government and the private hospitals can work on this issue. Yun na lang po.
Doktora, wala kaming doktor. Sa ER na lang kaya kami maghanap.
Naku po. This is something that that's why I asked that question, Ma'am Kate. Yung kailan hindi dapat. This is an issue eh. Please, lalo na sa US, dito sa Pilipinas, not so big. Eh. Sa US kasi, and I encountered this, maraming taong ayaw magpatingin for whatever personal reason, okay? Tapos, pag may nangyayari po, parang nagpapadala sa ER, yun na yung ginagawa nilang clinic. Lalo na po kung bayad po sa gobyerno. Luckily, in the Philippines, this is not very common kasi po, alam po natin that's very expensive to go to the ER. But my advice po sa taong nagtatanong ng ganito, it is better kung sana ho, kung may doktor kayo and that you either do telemedicine or go to the doctor in the clinic. Kasi kagaya po ng kwento ko, napakagulo po talaga ng ER. Kung doon ho kayo maghahanap ng personal yung doktor or personal na kalinga, dahil wala kayong doktor, it is not really the place to go. Maiinis lang po kayo. So only go to the ER if it's an emergency. Kung naghahanap po kayo ng doktor, go to the ambulatory the next day. Ikaw, Reyna, what's your opinion on this?
Okay. Ako kasi, Doctor, I've witnessed everybody, almost everyone na nagpupunta sa ER because I was an ER nurse. So, I have the idea kung sino ba dapat ang pupunta at sino ba dapat ang hindi. If it comes to, tama po kayo, kung kaya pa ng tao, sa OPD na lang muna siya. Lalo na ngayon, it's pandemic, no? But then, if...
hindi maganda doon.
Yeah. But then, if nakikita mo naman na may dumudugo na, may open wound na, or loss of consciousness, and merong mga kakaiba ng behavior, well, then that's the time you have to go to the ER because you don't know and you cannot perform any
first aid. Baka kung nangyari sa bahay nyo naman.
Yeah.
Oo.
And another thing.
Pero halimbawa, tinatamad lang ho kayong pumunta sa doctor in the morning. Wag ganon. Kasi the whole thing is unpleasant for everyone and for you personally.
Also, Doktora, if I may have to add dun sa point niyo po kanina regarding sa mga doktor, if there's an ER, if you have a doctor na, then most probably the ER will accept you, no? Most cases talaga, tatanungin ka kung may doctor ka na. And I have encountered, I would not name the hospital na nung wala akong nasabing doktor, pinalipat ako ng hospital. It happens. It
Reyna, I'm
happens.
sorry. Hindi yung tanong kung may doktor ka. Ang tanong kung may pambayad ka. Sorry.
That's another
Hindi, kahit
question.
wala ka pang doktor, maglabas ka ng
Ah,
5K, papapasukin ka doon.
that's another question. Plus, pagkabuntis naman talaga kayo, ibang kaso. Pag kaming naramdaman kayo, pumunta na kayo sa ER agad. Yun ang isa pang mga kailangan na dinadala talaga sa ER. Plus, yung may mga life-threatening diseases. Like, siguro kung may cancer siya or meron siyang ah, lifelong illness, 'di ba, Doc? Yun talaga pag may
Hindi,
naramdaman kailangan
sorry, I beg,
ER.
oo naman, I agree. Pero
Mm.
again ha, yung, for example, even if you have cancer, you don't need to go to the ER. What you need to do is call your doctor sa may cancer and then mag-usap muna kayo. Kasi baka mabigyan ka ng advice. Ngayon, kung talaga sabi ni Doc, pumunta ka ng ER, then pumunta ka ng ER. Pero at talagang I really beg people to try and call muna. Kasi there's a lot of things that can be solved over the phone. Yun. Sa
Agree,
mga
agree.
pregnant, kahit na, syempre, obvious ba kung lumalabas na yung bata, kaya need to go to the ER. But I really believe muna, Reyna, in prior communication. Malaking bagay. I really, really believe that. Kaya lang, eto naman yung kwento ko sa'yo. May pasyente ako, tumawag sa akin, doktora, hirap na pong huminga yung pasyente. Eh, may pulse ox. Sabi ko, pero parang we don't know if we should go to the ER. So I said, ano yung pulse ox? 70. So oh my God, I was in so much shock. You know what I ended up doing, Reyna? Pumunta ako sa bahay ng pasyente, sinakay ko siya sa sasakyan ko, and I brought her to the ER. Okay? Just ko, ako yung naging ambulansya. That was actually one of my first major patients. Up to now, they're still my friends.
Okay. Do we have another
Ayan.
question? Yeah. Doktora, bakit kami pinauwi sa ER? Parang ang bilis lang. Follow up na lang daw sa clinic.
Ayan. Yan ang kwento na ito lang honestly, sa sobrang po talaga, they try to send everyone home who can be sent home safely. Natin na naman po kaya't nakausap, I'm sure. But it's not good rin naman po sa inyo na tumambay po sa ER. Kasi most of the time, they're just gonna find out kung buhay ka pa o hindi and if you can go home. And then if you can go home, then you can go to the clinic the next day. Parang ganun ho kasi they need to find space for those people who are really dying. And number two, parang i-temporize ka lang until the next day, maybe give you some antibiotics and then you need to see your doctor. So talagang I'm sorry to say, sa sobrang dami po talaga ng tao sa ER, hindi siya talaga ganun kalalim na i-address lahat ng problema mo sa mundo. Okay? Ang gagawin lang talaga nila is, can you survive the next 48 hours in your home? And then, if you need antibiotics, ibibigay or some immediate gamots, ibibigay. Pero yung long time, yung mahabang plano po sa sakit nyo, yung anong mangyayari, all the testing, most of that will be done po sa OPD. So, consider it a blessing that you were sent home and consider it a blessing po. And siguro the next day or the day after that, schedule na lang po ng clinic visit. Okay?
Doktora, how can I convince someone to go to ER? Takot na takot po.
Nako, yan po yan. Well, you you cannot convince anyone to go to the ER. What you can do, especially if it's your mom, it's your dad, it's your sister, it's your husband, okay? What you can do is to promise that you will bring them once they are ready to go. I think that's really the best thing. Number one, talk to their doctor. Number two, if the doctor said go, then tell them that the doctor said go. Number two is talk to them and tell them na anytime that they feel na kailangan talaga nila, it's that you're ready to bring them. Kasi talagang matindi po talagang panahon ng COVID ngayon. A lot of people are very scared and are very scared of the gastos. I'm sorry. Talagang honest problem po talaga yan. So what I could say na lang po is kindness and patience. And readiness to bring the person once they do decide. May bati ba tayo?
Dear Doktora, gwapo po ba ang mga doktor sa ER? I'm remembering si George Clooney. Ha ha ha.
Just ko, what kind of question is that? Sorry, marami lang pong mga langaw dito. We are in the fields. Well, yes, guwapo po si George Clooney. Well, I have worked in ERs for a long time. Marami rin guwapo. Pero more than guwapo, ang kailangan po nating doktor ay yung mabait at matalino. At saka po yung makatao. And with a combination of those three plus guwapo pa po talaga, talagang gagaling ka on the spot. Baka naman balik kayo ng balik sa ER dahil gwapo, wag. Reyna, ang mga nurse ba punta ng punta sa ER dahil gwapo yung doktor? I don't know.
Nako, doktora, tatawa na lang din ako. Yun na lang din, Doc.
Maybe.
Ganito lang yan.
That's a nice question, though.
Dalawang bagay lang nangyayari sa pasyente ang napapansin ko pagka may gwapong nurse or gwapong doktor. Either mas madami silang sakit or either gusto na lang talaga nilang magkaroon ng sakit. Ganon. Bigla silang nagkakasakit. Doc, totoo yan.
Ang cute naman ng tanong, kasi masyadong serious na tayo talking about all these people dying, triaging, cute naman yung tanong. Thank you for that question.
From Mr. Loy, Suhay po, Dr. Ana York Bondoc, watching from Masantol. God bless po.
Hi, Loy. How are you? Nandun lang po ako sa Masantol a few weeks ago and I hope to come back. Hi, this is Kapitana. Hi, Ma'am. How are you?
From Mr. Brian Cruz, Doc, severe myalgia, ERable po ba?
If it happened like right at that moment na sumakit yung buong katawan nyo, well, then you can go, But if it's a long-term problem na po, then, again, my best advice to you, Brian, call your doctor. Kasi, rin, ang malaking bagay ito Kasi your doctor knows you, okay? Alam niya yung capability ng katawan mo. Alam mo yon, matagal na kayo nag-uusap, alam na niya kung ano yung gamot na working for you. And alam niya rin niya pag hindi na working for you yung gamot. So if sa akin, Brian, is call your doctor and mag-usap kayo and decide whether it would be good for you to go to the ER or not.
From Mr. Elena Gutierrez Padilla, good PM.
Hi, Elena. Good PM.
M. Vives, hello po, Doktora. Have a blessed day po.
Hi, Em. How are you?
From Miss Leonora Matic Silva, hello po, Doktora. Good evening po.
Hi, Leonora. Kumusta ka?
From Coach Hezir Garingo, hello po, Doktora Congresswoman.
Coach.
From Miss Rowena Reyes, hi po, Doktora, watching from San Miguel, San Simon.
Rowena, how are you? Kumusta San Miguel, San Simon?
From Miss Julie C. Ordonez, watching from San Simon. Good PM po, Doktora.
Julie. By the way, I'd like to read this, okay? The Diabetes Center Philippines, this is Nutrition Month. Ito, pinapakiusap po ng kaklase ko. The Diabetes Center Philippines is requesting the Philippine Center for Diabetes Education Foundation is having the 29th Diabetes Awareness Week. Virtual daw, yes, virtual nga. So it is a virtual mass gathering to prevent and fight diabetes. This is on July 25, 2021. Thank you, Dr. George Tan. Dr. George Tan po yung kaklase ko po who did the ABCs of diabetes with us. And they are requesting po na to invite everyone. Hindi po niya binanggit kung mga doctors, but it looks like pati lay. So, sige po. This is on July 25, 2021. We'll be posting po this on our Facebook page sa mga diabetics po na nakikinig. Okay? Anyone else wants to share their ER experience?
From Mr. Brian Cruz, Doc, may pagkakaiba po ba ang OPD at ang ER? What a good question.
Ay maganda. Okay? This is really, what is emergency room? Emergency room po, yun yung talagang biglaan na nangyari or life-threatening po na nangyari or sobrang nervyos. I never take away, hindi ko minamaliit ang nervyos, Reyna eh. Kasi sometimes talaga, pag talagang feeling ng mga tao may nangyayaring masama, usually may nangyayaring masama. So talagang kung may acute na nangyari, which is right at that moment, meron hong life-threatening na nangyari, whether it's an accident, a trauma, or heart attack, stroke, ganun po. And if you really feel that you need to go, okay? Those are the three reasons that you should go to the emergency room. What is the outpatient department? Yung outpatient department, siguro there should be another day on OPD, no? Outpatient department, yun po yung mga clinic ng mga doktor. Tumitingin po sila ng mga pasyente. Usually, the outpatient department works from 8 in the morning or yung iba 7 hanggang 6 o'clock po ng gabi, sumasara po siya. Okay? So when should you use the OPD? You should use the OPD pag naglalakad ka pa. Kung may doktor ka naman. Sa tingin nyo naman ho, malakas pa yung katawan nyo and you can still go to the doctor, instead of makipagsiksikan po sa ER na talagang namamatay ho yung kanan at kaliwa nyo, as much as possible, kung kaya nyo na lang po, then go to the OPD. Ngayon, kung talagang serious naman, di-admit po kayo from the OPD. Okay? So my advice to everyone, if you can go to the OPD at kaya nyo pa naman po, or outpatient, or clinic, you should make a clinic appointment or an outpatient appointment. Okay? Use the ER only if you feel like something very, very serious is happening or talaga pong gitna ng gabi at sarado po yung OPD and you really need to see a doctor. Okay? Why do I advise this? Kasi po, aside from nakakagulo din ho kayo sa ER staff, hindi ko naman minamaliit yung problema nyo. I'm not doing that, ha? But the ER po is a place na talaga nagbarilan, nagsaksakan, parang you don't want to be there unless you need to be there. Okay? Kayo naman po, maaabala din po kayo. At again, kung talagang kailangan, talagang kailangan.
I think okay, last one from Miss Elena Gutierrez Padilla. Blessed PM. Meron po bang government rehab sa mga alcoholic na talaga? Oh my goodness.
Naku po. Well, I am a psychologist also by training. So, yes, I have sa US po, no, and I would say this, we admitted a lot of alcohol intoxication. Okay? Marami po talaga sa US na na-admit. In PGH, siguro sa dami ho ng mga talagang heart attack or what, parang hindi ho masyado. And I would agree with you that there needs to be a focus on alcohol abuse. Kasi po, that is really one of the most common addictions. More common pa ho than drug addiction eh. At it is an addiction po. There are some government rehabs po for drugs and I would assume po for alcohol rehab also. But again, sa amin po, ito lang ang alcohol and sa amin we have a lot of patients po who were admitted for drinking too much, lalo na sa US. Sa amin, sa PGH ER, a lot of people, and this is so sad, drunk drivers po. My brother was a victim of a drunk driver po, no? Bata po ho, si Kong Rimpi, nabundol po sila ng isang drunk driver. And actually, they were going to blame Rimpy and they were college pa lang eh. They were gonna blame Rimpy and his friend for what happened. Until my dad noticed that yung kabila pong nakabundol sa kanila, talagang lasing. Ano na po he was a senior manager po sa Pure Foods and inabla po ng tatay ko, not because to get money or what, pero to get this guy off the road. Kasi sabi ng daddy ko noon, kung hindi po natin gagawa ng paraan, the next person could be dead. Okay? And I'm also sensitive, eto lang this is a very sad story that I personally learned. And I learned my lesson from this. A patient came in po with a motorcycle accident. Ngayon po, ang dami ho talagang lasing na dumarating sa PGH. He was incoherent and not talking well. So parang kami po, mga students pa lang po kami, and that's why I would share this story because I regret it to this very day. parang ginudge po namin yung tao, lasing lang yan. Okay? Maybe we were not so smart. Maybe we were just so young and bata pa kami, we didn't know. Okay? So, I would have say, pumasok po talaga sa utak namin, lasing po yung tao. And that's why maybe he fell off his bike or whatever. Okay? Reina, I'm sorry to say, within 5 minutes, the person parang nag-ano siya, he collapsed in front of us. Basically, he had a major motorcycle accident. At yung kanyang confusion and disorientation, and na attribute namin to alcohol instead of giving him the proper treatment that he deserved. To this day, I really regret that. Um, so it's something that is always at the back of my mind. And for those who work in the ER, please do not judge people kung lasing sila. And so what kung lasing sila? They still deserve the kind of care that you are supposed to give. And I learned this very early in my career. So sana po hindi rin ho kayo mamatayan ng pasyente like what happened to me. But let you know that to the relatives of this person, I never met them anymore. Pero to this day, I still remember that day sa PGH. Sometimes as a doctor, you really make mistakes. You judge people. Pero magandang tanong po ito, mama, no? Whether someone is lasing or not lasing, when that person comes to the ER, we have to give him all the respect and the care that he or she deserves. Yun lang po. And magandang hapon po sa inyong lahat.
I guess that's all that we have po, Doktora.